remember my husband and I, when we went to Peru, we got off the plane and my husband I looked at him and you could tell that he was short of breath. And I'm like, what is wrong with him? And I said, oh no, is there a problem? But I was also feeling really short of breath. And I'm like, what is going on? And it just didn't hit me at the time. Sure. And we got to the hotel and we were carrying our luggage and we were huffing and puffing. And he was like, what's going on? And then suddenly it hit me.
Welcome back to another episode of the Doctors and Dollars podcast. As always, I'm your host, Nate Crannell. Today, we're talking about traveling the globe and keeping good health while you do it. I'm joined today by Dr. Tammy Allen, board-certified family medicine physician and an avid traveler. She's the CEO and founder of Travel Meds to Go, a telehealth platform that provides convenient and personalized pre-travel medication and prescriptions, as well as advice to travelers embarking on domestic and international adventures. Having explored more than 50 countries across 6 continents, she is the expert to provide travelers with the knowledge and the guidance they need to ensure that their journeys are both successful and unforgettable. Welcome, Dr. Allen.
Thank you. It's great to be here, Nate. Thanks for having me.
Absolutely. What is going well today?
Well, today, it's a great day. I'm getting ready to go on a medical mission to Jamaica tomorrow, so it's a great day.
Oh, you got it. The travel, the day before travel is always like super adrenaline filled, and the anticipation, you just can't wait to go.
Right.
That's awesome. Well, everyone catches the travel bug, right? You know, regardless of your profession, your background, your ethnicity, or your bank account, right? Most people yearn to travel the world, and you've done it. So First, tell us where your love of travel came from, and then how you've turned that passion, along with a successful career in medicine, into a thriving business like Travel Meds to Go.
Well, I've actually loved traveling since I was a kid. My parents instilled that love in us. We didn't fly anywhere as a kid, but we took a lot of road trips up and down the East Coast, and we'd stop along the way and hit the welcome centers and have picnics and go visit little spots off the beaten trail. And so, I always enjoyed travel. But my love for international travel started in medical school. So my 4th year medical school, I convinced the dean that I needed to do a rotation in Mexico, a Spanish immersion rotation. And she agreed. I went. I was there for a month and I fell in love. I was absolutely, the travel bug had hit me and I've been traveling since.
That's awesome. Kind of like the study abroad. You try and convince your parents while you're an undergrad. You're like, hey, I really should go to Europe for a year and study. And they're like, wait, what?
Right.
What were some of the hesitations from your dean as you said, hey, I think I should go to Mexico for a Spanish immersion trip as part of this medical school?
Well, the good thing I went to Wake Forest University School of Medicine, and they were dabbling in a lot of different things back then and still are. They have been like a front runner in the seeing patients from the first weeks of medical school. And so it didn't require too much convincing. They were like, okay, it's something a little out of the box, and they were good with out of the box. And so it worked out for both of us.
Well, there you go. So I guess before I move on, tell me a little bit about your time in Mexico then, as a medical student, probably just enhanced your love of travel that you already had from a kid.
Absolutely.
You just took it to the next step.
Yes. So I found this program that allowed me to, in Cuernavaca, Mexico, it allowed me to stay with a family, and the family spoke really no English. So my first day there was such a culture shock. I had a driver pick me up in Mexico City. We drove about an hour and a half to Cuernavaca, and they dropped me off at the family's home, and they knew, hi, how are you doing? And that's about it. I mean, and the school purposely did that because they wanted you to learn Spanish. And so I remember the first thing that I was trying to communicate to them is that I wanted to use the phone. This was pre cell phones. I mean, there were cell phones, but they weren't popular. And I was trying to use the phone, and the lady kept trying to tell me, no, you, I don't, there's no phone to use. And I was devastated. And I remember I broke down into tears, and she's just sitting there like, what do I do with this woman? And I was like, this is starting off not too well.
Yeah.
But after I got past that, it was awesome. I mean, she cooked 3 delicious meals a day. She took me on tours of hospitals and medical centers. The school, of course, took us on different field trips, and I met people that also loved traveling, and every weekend we would go somewhere via bus, which was also interesting, and it was just a really good experience.
Yeah, what an amazing experience. Are you fluent in Spanish?
I am not.
Okay.
So I spoke it much better then, but if you don't use it, you lose it. And I really thought I was going to go to an area that had Spanish speaking, and I actually purposely did residency in Phoenix, Arizona. But what I didn't realize is that in Phoenix, most of the people are second, third generation, and they don't really need my Spanish.
Yeah. Common misconception. Hey, you're pretty close to the Mexican border. You must speak Spanish.
Yes. So I didn't get a lot of Spanish there, but so I speak some Spanish, but I'm definitely not fluent.
For sure. What was kind of that pivotal moment then? Because obviously, when you were a locum tenens physician, or you have been your whole career, and we'll definitely talk about that here in a little bit. But at what point in your career, once you were attending and you're out in the world, like as we think about travel meds to go, this startup that's starting to thrive, what was kind of that pivotal event or moment that happened where you're like, I should turn my love of travel and my medical expertise into a business?
I think it started sometime during COVID. So, of course, the world changed with COVID. And as a locum tenens physician, our business actually stopped for probably 6 months. Like all of the contracts we had, they cut them out. And, most of us didn't have a job. So we were scrambling to figure out what to do next. And I started doing a lot of telemedicine because, of course, I could do that from home, and telemedicine had become a big thing then. And so I started doing a lot of telemedicine. The pay was really bad. And I kept thinking, this is ridiculous that, they're paying doctors nothing to see patients, and they're making all of the money. And then all along, like over the years, I had been trying to get prescription medications for travel from my primary care physicians or nurse practitioners or whoever. And most of them would say, no, you need to go to a travel clinic. And I was really frustrated with that. I understand why they did that, because in this insurance world, we have 15 minutes or 10 minutes to see a patient, and most of them were not comfortable prescribing anti-malarials. They didn't have the time, and they just didn't want to deal with it. And I kept saying, this is ridiculous. You're primary care. You're supposed to take care of all of my primary needs, but they would send me to travel clinics. The first travel clinic my husband and I, the first, even before I got married, the first travel clinic, I spent several $100s. And I was like, this is crazy. And then when I went with my husband, we both spent about $500 each at a travel clinic. Oh. And I said, this is absolutely insane. And so just thinking about those things, and then with COVID changing things and me getting in the telemedicine space, I said, you know what? I can combine this. I can still do medicine and do what I love, and I can travel and do this. I can be overseas doing this. I don't have to be sitting in my home in Atlanta. So that's probably during COVID is when I started thinking about it. It wasn't until after COVID that I started working on it diligently.
Yep. And so travel meds go, obviously there's probably tons of medications and prescriptions that you can do, but what are like the most common ones that you're providing to travelers, through your platform?
Right. So I do anti-malarial. I mostly do Malarone because Malarone has so few side effects. And you can still take it anywhere in the world. Like chloroquine, you cannot, is resistant in most of the world. So I do a lot of Malarone. I do a lot of azithromycin for traveler's diarrhea. A lot of people still come to me looking for Cipro. And I tell them, if you really want Cipro, I can give it to you, but that's no longer the recommendation from the CDC. So I do a lot of that. And then I'm doing a lot more altitude sickness, which is surprising to me because I didn't know if that was going to be a popular one or not, but it is. So I'm doing a lot of acetazolamide for altitude sickness. And I do a lot of prescription refills. So as part of that, I also will refill prescriptions up to 3 times a year. So you can't use me as your primary care physician, but I will be the fill-in doctor if you need. So
Gotcha.
I'm trying to think, those are the major things that I'm prescribing. But I prescribe anything pretty much that you need pre-travel except controlled substances.
Yeah, for sure.
Scopolamine patches for motion sickness as well.
So yeah, that's interesting about the altitude sickness because just to clarify, that's not like flying on a plane type thing. That's more like you're in Denver where you're thousands of feet above sea level, and it kind of messes with the biology of some folks.
Right, especially when you go to Central and South America, like Peru is what I can't remember. It's like it's up there about 10,000 feet.
Oh, wow. Yeah, you bet.
So. I remember my husband and I, when we went to Peru, we got off the plane and my husband I looked at him and you could tell that he was short of breath. And I'm like, what is wrong with him? And I was worried because he has a little bit of leaky valves. And I said, oh no, is there a problem? But I was also feeling really short of breath. And I'm like, what is going on? And it just didn't hit me at the time. Sure. And we got to the hotel and we were carrying our luggage and we were huffing and puffing. And he was like, what's going on? And then suddenly it hit me. I was like, we're at an extremely high altitude. We can't breathe. So yeah,
and is that just a constriction of like the alveoli in your lungs, or what is it the altitude sickness does to you?
So your body has to adjust to that. Is the concentration of oxygen in the air is much less at those higher elevations, and your body needs time to adjust to that. And usually it takes 2 or 3 days for that to happen.
Oh, wow.
And acetazolamide helps speed up that time.
That makes sense. When you're and just to clarify, these are all like pre-travel prescriptions that you're filling, right? This is somebody saying, "Hey, I'm going to Peru next month. What do I need?" Or I'm getting ready to fly to Kenya for a 3-week trip. What are the types of are they asking you advice on like what do you think I should do, or is it more of just, "Hey, I was told by my primary care physician that if I'm going to Kenya, I need this, and can you provide it to me?"
So mostly what I have right now is I have an asynchronous telemedicine platform, which means it's not done in real time. Patients fill out an interactive online interview. And then I get those results, I review them, and then I decide what they need or don't need. We can chat back and forth. We can talk on the phone. It's their preference if I need to. But what I'm discovering is that most of the people that use that, they already know what they want. They've already done the research. And they're just telling me, hey, I'm going here. Choose my anti-malarial. Some of them will even say, well, I've used mefloquine in the past and that's what I want to use. And so, and I, as long as there's no contraindication, I will honor that. But I look at their medical history, I look at their medications, and then I decide whether or not it's okay for them to take that medication. Now, what I am adding soon, I've actually already added it, but I haven't advertised it yet, is a concierge type consultation where you set up an appointment with me. And we talk for about 30 minutes about where you're going, what you want to do, what do I think you need, that kind of thing, for people that just don't want to go to the CDC website and try to figure it out themselves.
Sure. And then there's still the due diligence on your end as far as after that 30-minute conversation, knowing, where they're going. You can kind of tell their body type or anything, right, over a Zoom or something like that. But then still looking at their medical history to understand, okay, I think they should take this, but based on their medical history, there's something else that they would be best for them.
Absolutely.
Gotcha. And you offer advice as well through your platform. I think that's really cool. So is that still asynchronous in that people like post questions to you, as they fill out the form, or are you posting and blogging about different topics from past patients saying, hey, if you're ever going to this place, here's some ideas?
Yeah. So it's information that I provide in they'll get a summary at the end, and it's information that I provide there. I also have a blog that I haven't been keeping up as well as I would like to. Just been really busy, but I do have a blog that talks about different things as well. And some patients just want information, and they will put that in the other box and say, I want, in addition to this, could you give me information on that? And I will most certainly give them information. So
for sure. How much of that is like travel advice? Because I said in the bio, you've been to over 50 countries. I got to imagine that most of the countries that people are, as they contact you through Travel Meds to Go, you're like, oh, I've been there, back in 2008 or something like that. I got to imagine most of the countries you're seeing, you've been there. So is there some travel advice kind of built in there of like, definitely go to this restaurant?
No, no one has asked me any of that.
That would be one of my first. I'd be like, hey, give me the medication, but also I got to imagine you've been to Peru and I'm going. Give me give me the lowdown.
Yeah, I agree. Absolutely. Because I love to give advice.
What are some of your favorite countries you've been to?
I loved Australia and New Zealand. Loved them. But my favorite probably is Cape Verde. Cape Verde is beautiful. It's the people are friendly. It is inexpensive, and oh my goodness, the sea is just unbelievable. So I love Cape Verde.
Very small country too, correct?
Yes, very small country.
Yeah,
I can live in Cape Verde.
Really?
Yes.
Is it just? I'm trying to remember. It's like just below the equator, correct?
See, now you're asking me something that I can't answer.
Hey, you're the travel expert.
I know, but I can't remember if it's below or above the equator.
For sure, I've been to I've already been to 10 countries, not 50. I've probably been to more than half of the states in the United States, but I get friends, family, stuff like that. I always get asked questions on like, hey, you went to this place in 2016. Tell me about it. And
right. You're like, that was 8 years ago.
Exactly. That was so long ago. You mentioned right at the beginning, so you're going to Jamaica soon for a medical mission. Yes. Tell me about that cause and what the desired outcome is for that trip.
So I am a member of this was through the Georgia Academy of Family Physicians. Yes. So, of course, I'm a member of the American Academy of Family Physicians and part of that is the Georgia Academy of Family Physicians. And there is an organization there that they started a few years ago, and they provide school physicals and I didn't know this, but apparently school physicals are very expensive in Jamaica, but all of the kids are required to have one before they start school. And so the organization was recruiting doctors. And so Georgia Academy of Family Physicians advertised in their newsletter, and I applied and thought we thought it was a good fit for both of us. And that's how I am going.
Is that is it like the cost, I guess, associated with like just the general checkup for kids? Is that Is that higher cost pretty common in a lot of countries, or is that just Jamaica?
That is a good question because I don't know a lot about the school systems in other countries, but I can imagine that because I can imagine that in a lot of third world countries, there are obstacles like that where they have to
Mm.
get school physicals and it costs a lot of money. So these school physicals are totally free to the students. And apparently, when they first started, they had like a normal 8 hour day. And then people heard about it and they wouldn't stop coming. And the group says, we don't want to turn anyone away. So now it's more like a 12-hour day.
Oh yeah,
So fortunately, it's only going to be a few of those 12-hour days, but I'm sure it's going to be so much fun. And then
yeah,
we're taking some gently used soccer cleats and pads as well.
very cool. Yeah, I asked just because so partnering with Grand Vision and then obviously Doctors and Dollars, we're getting ready to launch a 5-day financial challenge for
Okay.
physicians, and part of the financial challenge is they gotta go through and fill out some worksheets around trust and estate planning, income
Hmm.
statements. They get to learn about wealth mindset and tax reduction strategies, things like that, to generally help physicians with their own personal finances. Well, if they finish this 5-day challenge, they're then invited and have the opportunity to go. We're going to do a mission trip in Guatemala in
Oh.
mid-February. And so my business partner with Grand Vision, he has a house in Guatemala. He's gone down there and worked with a school. He was actually on the school board of this school in Guatemala for
Hmm.
several years. And so we're going to take a big group of doctors down there and do some of those things. I hadn't even thought about school physicals though. That's just
Yeah.
a very interesting, very nuanced thing that I wouldn't have thought of.
Yeah. And I do a medical mission to Guatemala every year,
You should
to
come to
this
ours.
area. Yeah, yeah, I could. I definitely could. So just send me the information.
Absolutely.
But this one is on the Rio Grande. And we our last day we do school physicals at, it used to be an orphanage, now it's more of a boarding school.
Mm,
So yeah, but I don't know if I know those students don't have to pay anything because
sure.
their tuition is covered and everything involved with that. So yeah, but I would love to do that.
Yeah. I'll send you the info, but um,
Okay.
it's the first one I've been on. My business partner Mike has done a lot of mission trips. He's taken a lot of groups down there from the United States to Guatemala
You're
to.
gonna love it.
I am super excited to introduce to you the Doctors and Dollars 5-Day Financial Challenge. I'm Mike Neubauer, I'm CEO of Grand Vision Companies, and I'm the one that you see on the Wealth Wednesday and Daily Dollar episodes with Nate. So Nate and I are partnering again to do something even more exciting, which is the 5-Day Challenge. We're taking the best of all of our episodes, all of our expertise and knowledge, and we're condensing it into an impactful and purposeful 5-day presentation, 1 hour per day, for 5 days, to give you everything you need to build that foundation for your financial future. So if you're looking to gain the pieces, you want those puzzle pieces and find out how they fit in your financial plan, head over to the Doctors and Dollars website, join us on the 5-day challenge. We're putting it together for free, so you got nothing to lose. We look forward to seeing you on the inside.
What's the I want to say the feeling, like what's the what is the feeling that you get, once you've helped these people and you're done with those 2 or 3 long days? uh Tell me about some of the emotions that you're feeling.
So this is the shortest medical mission I'm doing. My medical missions tend to last a week,
Nice.
sometimes 2 weeks, but generally a week. And at the end of the week, you're tired, you're ready to come home, but you're just, oh my goodness, it's such a great feeling to know that you've done something that benefited someone and that they're really appreciative of it, and that you're doing what, in my opinion, we were put here to do. Give back. And
Hmm.
so it's a really, I mean, it's a really good feeling.
Yeah. Yeah, I asked my business partner Mike about it, and he was like, I don't know. He's like, it's a weird sense of like gratitude. Like they're grateful
Yes.
that you're helping them with things, but you have like a
Yes.
sense of gratitude that you are able to just that
Yes.
you have the ability and the financial means and whatever it is that got you
Hmm.
there to be able to provide that service to
Absolutely.
folks who can't have it. So he said it's a very weird feeling, but it's very satisfying
It
just to
is.
to have that. So very cool. Well, you've
which
actually
is why I
spent,
keep doing it.
yeah, I bet. I mean, you've spent your entire medical career, as a locum tenens physician, which I think is very cool. It's very unique. I told you before we started recording, like, of the nearly 50 physicians that I've interviewed on this podcast, you're the first locum tenens. Some have done it, maybe part time, but
Mm-hmm.
or in a brief stint during their career. But for you to do it your entire career is very cool. So, share some of the countries that you've visited where you've leveraged your medical expertise.
So as a locum tenens, it's very difficult, not impossible, but difficult to go to other countries and work.
Mm-hmm.
Generally, it will be you can go to Australia, New Zealand, Jamaica, some of the Bermuda, some of those English speaking countries, sometimes England, but generally it's difficult to do that. Not impossible though. So I tended to stay here in the States.
Mm-hmm.
The one that I did do, which is overseas, but still it's a U.S. territory, is Guam. So my husband and I went there for 3 months during COVID, and I worked in a hospital for 3 months there. But typically my the places that I go are in the U.S. and they tend to be underserved areas, at least in the beginning. Now I tend to stay close to home, but I really liked working in those underserved areas. And my first assignment was on the Navajo reservation in northern northern Arizona. I'm sorry. And that was such an experience. A great experience, but just eye opening. Because at the time, you just wouldn't think that places in the U.S. would still not have electricity and would still
Sure.
have dirt roads. And, to get to the nearest store, it was a 2.5 hour drive, that type of thing. But beautiful country and beautiful people, just
Absolutely.
very,
What
very different.
What's the general perception of a locum tenens physician when you are going to these other states, these other Guam is like a territory? What's the general perception from the patients? As you're coming in, and like you said, you were there for a short period of time, sometimes 3 months, and then what's kind of the perception or challenges you may have from other physicians?
So from a patient standpoint, they tend to be pretty they're grateful. They're
Mm.
like, oh man, because I'm in these areas that are underrepresented to begin with. And so they're pretty grateful and like, oh, thank you for coming out here helping us, blah, blah, blah. So from that standpoint is good. It used to be, and things have changed a lot because there are so many people doing locums now. It used to be that from the doctor's perspective, they didn't they looked at locums as just this someone that came to help, wasn't really part of the team, and was maybe even lazy.
Mm.
That's how it used to be. I think now doctors are so used to being so busy and having locums as part of their team that the landscape has changed a lot, and I think we are more of a team now than we were in the beginning.
Yeah. What was there any challenges? I mean, because you're essentially sometimes coming into another healthcare system, I would
Oh,
assume, in these
always.
underserved communities. Yeah. So, are there any challenges you face, like with some of those healthcare systems, where it's like you don't agree with how they do things, or
Absolutely.
yeah? Tell me a little bit
Absolutely.
about some of those challenges or obstacles you've had.
Yeah. So, well, one thing, every time you go to a different hospital, there's a different system. So, there's Big Epic and Cerner, those are the big systems around right now. Even if one hospital is using Epic, if you go to a different hospital with Epic, there are going to be some differences enough to
I've heard
really
that. I've heard that.
cause you some chagrin.
Yeah.
But so that's one thing. Every EMR is going to be different. Of course, the environment is going to be different. I've been places where I don't know, the deep South, where women physicians weren't as respected. And, so everywhere you go, there's going to be a different type of environment. There are going to be challenges with the EMR. And those are things that you have to learn how to navigate. But I was getting ready to tell you about one of my experiences, and it just slipped my mind, and I apologize.
No, you're good. Was it in the deep south? Was it out west?
Was it out west or was it the deep south? And hopefully it will come back to me.
Well, you think of it while I kind of give this anecdote. I had a physician tell me one time they were explaining Epic, as a record system, right? And they said that like every Epic, like if you go to any different healthcare system around the country, they use Epic, but it's like different. I said, well, how can that be? Like if everyone has Netflix and you get onto Netflix, everyone's got the same choices of movies. Right. And he goes, okay, think of, if we're going to use that analogy, think of everyone has Epic, just like everyone has Netflix, but every system you go to, you might go to one and your Netflix is in Dutch, or you go to another one and your Netflix is in Swahili. And it's like everyone has Epic, but everything looks different in every system you go to. And
because what happens is that IT team gets their hands in there. And they're not physicians.
No, that's funny. What have been? I had asked you about the challenges first, just because if anybody's listening to this, they're like, man, I would love to be locum tenens. Like I've been thinking about doing that. She seems like she's really enjoying it. I always want to say, hey, there's going to be challenges, there's going to be obstacles, but Absolutely. what are some of the, I guess the benefits, the big things that you've really enjoyed about doing it versus maybe just being an in-hospital, the traditional W-2, salaried physician that we have so many of in the country.
Right. And for me, the biggest thing was just the freedom to do what I wanted to do. One of the reasons I went into locum is because I really disliked hospital politics and office politics. And as a locum, I can go in and do my job and I don't have to get involved in that. So that's really great thing. That was my probably number one thing. The other thing is I like to travel. So for the first few years of my locum career before I got married, I worked 6 months a year and traveled 6 months a year. So really, I worked to travel. And I love that. And then even after I got married and I got my husband on board with this travel thing, we probably traveled 2-3 months out of the year. So, I can just say, I want to work these days, this day, I want to take the month of January and the month of February off. And that is just, that was worth everything to me. And I can't imagine working someplace where I can't do that now.
Yeah. Where you got to plant your roots and, you only get so many days of vacation and, all the infrastructure that comes with that type of traditional position, I guess you could say.
Yes.
What does your husband do does he work remotely that he's able to, as you guys travel and you're taking time away from medicine, but he's still able to work, I assume?
So he's now retired, but when we got married, he was working for a quasi-government agency, and he had a lot of vacation time built up. And, his company was really, he actually was, what is it called? He actually worked from home. He was the original work from home person. Nice. Because they went around the state talking to different schools. And so he worked from home anyway. And then when he wanted to travel, they were really good about giving him time off and either use vacation time or, just not get paid or whatever. They were really good about giving him 2-3 weeks off and sometimes 4 weeks off at a time.
That was awesome. What a blessing.
It was.
To create that type of atmosphere for yourselves. That's very cool. How is your career path that you've taken? As a locum tenens, how's that been an advantage to you financially? And I asked this question just because I know back when I was a financial advisor at a Fortune 100 company, I worked with a lot of travel nurses, And again, this was post-COVID when travel nurses was a big thing. They have whole corporations now that all they do is, hire and distribute travel nurses. So I know that travel nurses, for lack of a better word, they make bank, right? During a short 13-week contract, comparative to full-time nurses, they're making a lot of money in a short time frame. And then a lot of them that I knew and a lot of my clients, they were traveling all over the place, right? They would just bank all this money and then they would go travel and then they would come work another 13-week contract and then they would go travel. Do locum tenens physicians, do you experience that kind of same, not just time freedom, but also the financial advantages that come with that?
So yes and no. So one of the differences between locum tenens and traveling nurse is that the traveling nurses, they really do bank. They get all kinds of per diem. They get paid a higher salary. As a matter of fact, during COVID, they were making more than the doctors. For me, what made mine more, even though I probably made about the same amount as an employed physician, what made it good for me is I had a lot of things I could write off. And therefore, I was in a different tax bracket than my friends who were employed. And so they were getting 40% of their check given, dedicated to taxes and whatever, whereas I might have 25-30% of my check. So it was a big difference in that sense. So yes, I was able to bank because of that.
Well, that opens up another host of questions, because this is me being naive around locum tenens. I understood the concept of it, but are you 1099 then through the hospital, or
I am.
We
are
okay.
1099s.
Do you create like your own LLC, or are you like your own business that you can write off, travel expenses and food and things like that, or how does that work?
I am. So for
Awesome.
the first, I think maybe within the past 5-6 years, I have become an S Corp, which is absolutely the best thing to do as a locum. But at the time when I first started, I didn't. It just seemed too complicated for me. I did my own taxes and I didn't want to deal with it. But, despite the fact that I was a solo proprietor, I still did well. But as an S Corp, I think it's even better.
Yeah. I mean, more importantly than money is honestly time. I mean, within our Grand Vision family office, all the physician families that are in there, like, our whole goal is to help them buy back time, to do the things that they love, to pay less taxes so that they are keeping more of the money that they're making. And so it sounds like, I mean, you've just found a way, and it's not like locum tenens is a secret, right? It's not like there's you found some loophole in the system that allows you to do it. But I guess why aren't there more? And maybe there is. Again, maybe it's my naiveness, and maybe there's
now
thousands
there are.
Okay, so talk about, and I'm not going to guess your age. Let's say from the year 2000 to now, how has the population of locum tenens changed?
Changed significantly. So I don't have a problem telling my age. I actually have a birthday coming up 2 weeks from now. I will be 58.
Nice.
But
happy early birthday.
Thank you. I went to school later. My whole life has been not your typical. So I went into military after high school, went to the Navy, but anyway, so I started medical school late. I was almost 30 when I started medical school. So I finished in 2002 and then went to residency until 2005. And so I've been out practicing since 2005. But, excuse me, when I started, locum was such a new thing. Locums have been around since the late 1990s, I think, but it was still very new in the early 2000s, mid 2000s. So I was one of the very few women. There weren't many women locums. And now, wow, I think we might be dominating. I don't have any facts on that, but I mean, there are a ton of women locums now, and actually a whole lot more locums, because what's happening is this new generation of physicians, they don't want this crazy life that the
Yeah,
the employed physician has in the outpatient setting. And and they want that flexibility to travel and do what they want to do. So they are flocking to locums like bees, so to honey.
for sure. Is there a is there a strong community of locums that you said that's dominated probably statistically by women? Is there a lot of conversation among locums? Is there a community where you guys are talking to each other or saying, hey, I really enjoyed working here or working there? What does that look like?
So I'm sure there are communities on Facebook. I'm in communities, but it's too large for me, so I can't stay connected there. But what I have noticed is that even though there are a lot of us, it's a small world, and we kind of go from place to place to place, and I'll meet someone that I worked with in Washington State in Georgia.
Oh, really?
So, and then we keep in touch. We'll text each other and say, hey, I'm thinking about going to this hospital. Have you worked there before? What's it like? So yeah, there's definitely a community there.
I love that. No, I mean, that's the best way to, because you maybe ending a stint at a certain place, and you're like, well, I'm not traveling until next month. I've got, a short time frame. I could work, 4 or 5 shifts. Where should I go? I think a quick text to someone to be like, hey, you been to North Carolina? Oh yeah, I worked in Charlotte at this place and it was really great. Here, reach out to this person to get connected. I think that's how communities grow. I think that's how they stay strong. Is just being able to have. There's a level of trust there, even if you don't know that person very well. Just to be able to say, hey, we're in this group together. We do the same thing. We have the same mindset and beliefs. Just to be able to reach out for a quick message and do your next thing in life, continue down that path, I think is super cool.
It is.
I think the big question that I've had, and it was one of the first questions I wrote, as I was preparing for our conversation today, is can someone go from being a full-time W-2 in-hospital physician to then becoming a locum tenens, but then maybe go back after a while? Or are those transitions very overwhelming mentally, financially, physically? Like, what are there benefits to doing that or not?
I think that if they go, because locums is not for everyone. And, if you test the waters and decide this is not what I want to do, then definitely there's no problem switching between the two at all. The only problem is the credentialing, which can take forever. But but otherwise, you can do that. I think that probably most people that have an interest in doing locum, they're not going back once they make that switch.
You took the words right out of my mouth. I was going to say, is it kind of one of those things where it's like you've experienced the hospital setting, you've been in maybe a private clinic, and then all of a sudden you go locum and you do a few runs of that, and you're like, yeah, I'm never going back to a hospital.
Right.
I had a feeling that was going to be your answer.
Never.
Awesome. Well, one of the last questions that I asked everyone on the show, what do the next 5 years look like for Dr. Tammy Allen?
So right now I'm transitioning out of hospital medicine. I do about 5 shifts a month, and my goal is to have travel meds to go, finance my lifestyle, and even have other physicians working for me on the platform. So that right now I'm working really hard to get to bring that to fruition, and that's what I see happening over the next 5 years.
Very cool. Travel in your future, other than Jamaica coming up soon, what are some of the places that you're going to be visiting that I should put on my bucket list?
Outer Banks, North Carolina. I hear it's beautiful. I grew up in North Carolina, but I've never been to the Outer Banks, so I'm excited. That's my birthday weekend. We're going to Belize. My husband's birthday is the weekend after mine, so we'll spend his birthday in Belize. And we've both been to Belize, but not been to Belize. We went there on a cruise for our honeymoon, and I did some scuba
Yeah,
diving
those don't
there.
count.
Yeah, but we didn't
Yeah.
stay. It was just a day visit. And then
Absolutely.
I am going with a girlfriend to Istanbul, Turkey. We're going for 2 weeks, and then my husband and I are going to Japan and tour Japan for 2 weeks.
It's awesome.
And then in December, we haven't totally decided. We toyed with Australia, New Zealand because he's never been, but now we're thinking maybe Central South America, but we're not sure yet. But we've got trips planned for this year.
You did, and all of that is through December.
Yes.
That's fantastic.
Yes.
That's very exciting. Don't forget, you got to come to Guatemala next February.
Okay.
So,
absolutely.
we'll carve it. We'll save you a spot for that.
Okay.
That's exciting, man. I was excited about my upcoming. I'm gonna have Cabo here in a few weeks.
Yay!
In Mexico. Grand Tetons in October
I
with
have not
our
been
Grand
there.
Vision family office members.
I want to go.
Yep. So we're flying a bunch of our family office members out there, and we rented a bunch of cabins, and we're gonna hang out there. Trying to think, there was somewhere in January, I can't remember, and then obviously Guatemala in February. So I was excited about my next 6 months, but yours sound cool. I mean, Japan that's definitely on the bucket list.
Mm-hmm.
I don't know a lick of Japanese, but I really love sushi and their culture and just the technology and the innovation that's over there. I'll get there at some point, but
I'll have to tell you.
I'll reach out to you after.
Yeah, I'll have to tell you all about it.
Yeah, for sure. Have you been before?
I have not.
Oh my goodness, that's exciting. I took Chinese in college, 2 semesters of Mandarin, and so when you said earlier that if you don't use it, you lose it. When it came to Spanish,
yes,
that's exactly how Mandarin is for me. I wouldn't say fluent. I was somewhat fluent in it, back when I was 21, 22 years old, but have not needed to use it since then and have completely lost it. So. Well, that's exciting. I'm glad that we took some time out of our days to connect and talk, and I really look forward to when our paths cross again in the future.
All right.
Thanks,
Thank
Tammy.
you for having me.
Absolutely.
It's been exciting. It's been fun.
Absolutely. Thanks, Tammy.
Okay.